The Beijing government is now requiring all arrivals in China to show proof of a negative nucleic acid test done within 48 hours. However, it's very unhappy with the travel restrictions issued in succession by other countries. On January 10, 2023, the Chinese embassy in South Korea issued a notice stating, effective immediately, the issuance of short-term visas for Korean citizens to visit, conduct business, travel, seek medical treatment, transit, and general private affairs in China will be suspended. It also acknowledged that the move was in retaliation for the entry restrictions imposed by South Korea against Chinese travelers. On the same day, the Chinese embassy in Japan issued a statement as well, saying that effective immediately, the embassy and consulates in Japan suspended the issuance of ordinary visas for Japanese citizens to China. It didn't say when the process would resume. South Korea previously announced that it would suspend the issuance of short-term visas to Chinese travelers between January 2nd and 31st, requiring travelers from China to show proof of a negative nucleic acid test taken within 48 hours before their trip. According to statistics released by South Korea, 76% of the recently confirmed positive cases entering the country were Chinese. As of January 8th, Japan has required travelers from China to take a nucleic acid test within 72 hours before departure and provide proof of it. South Korea responded on January 10th, saying the Chinese decision was regrettable and it had conveyed its position to the Chinese side. It's deeply regrettable that China took such a countermeasure by entirely suspending issuance of short-term visas. We make exceptions and issue visas for diplomatic, work, urgent business, or humanitarian purposes. The Japanese government said on January 11th that it had protested to China and asked that the action be withdrawn. As part of COVID-19 countermeasures, our country is implementing border curbs that will not hinder international visitors from entering and exiting Japan as much as possible. So, it is very regrettable that China has unilaterally taken visa suspension action for reasons beyond virus control. We have lodged a protest to China through our diplomatic channel and asked them to lift visa suspension. Our country will monitor the COVID-19 situation in China and its information disclosure and will respond appropriately. Since China announced in December 2022 that it would open its borders on January 8th, the Red Country has seen a tsunami of viral infections. Several countries, including the US, have introduced policies requiring travelers from China to provide proof of a negative test for the virus. The newly joined countries include Belgium, Sweden, the UK, Portugal, and Germany. In January 2023, India introduced mandatory COVID-19 testing for travelers from China, Hong Kong, Japan, South Korea, and Thailand. To assist China in controlling the new coronavirus, Taiwan and the US have expressed willingness to lend a helping hand. The US has repeatedly expressed its willingness to provide China with mRNA vaccines through private channels over the last month. Chinese diplomats, however, have said China has the vaccine to meet the demand. For many countries, the emergence of a highly transmissible variant of COVID in China has raised concerns about new variants. To date, there have been cases caused by the new XBB.1.5 strain of the main strain in at least 28 countries overseas. The Chinese government released the data. Our national monitoring data shows that from August 1, 2022 to the present, our country has monitored a total of 16 local XBB-related cases, all of which are XBB.1 evolutionary branches. Of course, this figure isn't very credible. This is because the Chinese Communist Party, or CCP, insists that fewer than 40 people have died from the COVID-19 virus in China since they eased epidemic prevention measures. The Chinese Health Commission announced in late December 2022 that it would stop releasing daily data on infections and deaths and instead release them monthly by the Center for Disease Control and Prevention, a move that stirred distrust among the Chinese public and outsiders. The reality is, various signs indicate that crematoria and hospital systems are crashing across China. This is a city in southern China where many funerals are held on a single street. This is a small town in the south where the blue lanterns and people wearing white are seen. People are paying tribute to their deceased loved ones. Satellite images taken by an American company, Maxar Technologies, show an unusually busy schedule of funeral home activity in cities scattered across China's southeast and northwest, including vehicles transporting bodies and residents lining up for their loved ones to be cremated. The World Health Organization, which has been rather friendly to China over the past 3 years, is also a little anxious.
From tag VE or otherwise.
WHO still believes that deaths are heavily underreported from China, and this is in relation to the definitions that are used, but also to the need for doctors and those reporting in the public health system to be encouraged to report these cases and not discouraged. However, having said that, we do, as Maria said, want and are working ever closer with our colleagues in China to try and understand better the transmission dynamics. But we still do not have adequate information to make a full comprehensive risk assessment, and therefore we will continue to try to encourage access to that data.
Suffering from a big infection rate.
So, exactly how massive is the epidemic tsunami in China? For the capital city of Beijing, its former chief scientist of the Chinese CDC Epidemiology Department estimated on December 31, 2022, that the infection rate in Beijing may have exceeded 80%. For Shanghai, China's largest city, a medical authority, also a semi-official who is a member of the Shanghai New Coronavirus Treatment Expert Group and serves as the vice president of a major hospital in Shanghai, told the official media, People's Daily, on December 31, 2022, that the current epidemic in Shanghai is spreading very widely and may have reached 70% of the population. This is roughly in line with what another prominent medical expert and a semi-official figure has said. On December 29, 2022, the well-known expert said that this epidemic wave, with infection rates already exceeding 50% in many major cities, will reach 80% in the Chinese New Year. Some local officials have reported even larger numbers than the doctors. Perhaps it's their effort to show the commitment to completing the task of getting the entire population infected. On January 9, 2023, in Henan Province, China's third most populous province, an official from its Health and Wellness Commission admitted, as of January 6, Henan's infection rate was 89%. In other words, nearly 90% of the province has been infected. It means a population size of more than 88 million people. So what is the rate of severe symptoms in this epidemic wave? China's top media, People's Daily, reported on January 3rd that a deputy hospital director who was responsible for the treatment of critically ill patients in 2 designated hospitals in Beijing said, among the infected patients admitted to the designated hospitals in Beijing, the percentage of critically ill patients is 3 to 4%. The report also mentioned that the director of a well-known hospital in Sichuan province said that according to clinical visits, there were about 450 patients per day in the fever clinic recently, of which about 10% of the symptomatic infected patients had to be hospitalized. Although the director only said that hospitalization was necessary, we can take it as a reference for the rate of serious symptoms to some extent. It is very unlikely that the Chinese medical experts will be willing to give actual data in the face of the party media. They don't build Fangsang hospitals anymore. They don't do nucleic acid tests either. This time, the cremation is on fire, so they start to build crematoriums. In addition to the scenes in hospitals and funeral parlors, another indicator that allows the outside world to peek into the severity of China's epidemic tsunami is the death of celebrities. As ordinary Chinese people who have passed away, the public won't know their names. But for celebrities, no matter how reluctant the central government is, it has to publish their obituaries. Since late November 2022, China has seen a wave of deaths of renowned experts and scholars, including academics from the Chinese Academy of Engineering, professors from institutions of higher learning, and numerous celebrities from the fields of culture, entertainment, and sports. According to an incomplete Wikipedia entry, as many as 338 people have died. Although there is no mention in their obituaries of official coverage of the cause of death, 297 of them died since December 17, 2022, or 87.9%, coinciding with the timeline of the outbreak in China. Among the deceased, 338 people, 26 or 7.7%, were under 60 years old. And the list is growing every day. For example, obituaries posted on the official website of Harbin Institute of Technology, HIT, a leading Chinese university, from December 25, 2022 to January 8, 2023, show that at least 16 professors at HIT died, including 1 member of the Chinese Academy of Engineering and 2 associate professors. Among them, a 60-year-old who passed away on December 30th was a female professor who served 2 consecutive terms as a member of the Chinese People's Political Consultative Conference of Heilongjiang Province. On December 28th, another professor passed away at the age of 68. The university is unique in that it has close ties to the Communist Party's military. In June 2020, the U.S. announced the cancellation of visas for Chinese students and researchers with direct ties to the CCP military-affiliated university and the expulsion of these individuals from the country. On December 18, 2020, the U.S. Department of Commerce issued another announcement placing a total of 77 entities on the entity list to protect U.S. national security, including this university. The death of an internet celebrity has, on the other hand, sparked concern among young people in China. On January 9, 2023, an obituary was issued on a Weibo account of a Chinese COS internet celebrity, which revealed that she passed away in Beijing on December 28, 2022, at the age of 24 due to illness, and that a farewell ceremony had been held in Beijing. Reports said she would later be buried in Guangzhou. This internet celebrity posted on December 18, 2022, saying, "I almost coughed my lungs out." On January 10th, the news of her passing was once on the top search list of social media Weibo in mainland China. Some netizens left messages disclosing that she was infected by the epidemic, but recovered and had another infection before passing away. There are 3 major bizarre things about this epidemic. The rapid spread, which is unique in the world, the high proportion of serious symptoms and deaths, and the high concentration of deaths among party officials and celebrities. As time goes on, more strange symptoms are still emerging. On January 9th, news on Twitter spread about the tragic situation in China's central city of Qingdao, a city of 9 million people in Shandong province. The tweet said, "Qingdao is in a state of emergency, death toll 10 times higher than usual. The strange virus is infecting at an alarming rate, and the outbreak is worse than Beijing." In addition, the outbreak has a strange phenomena. In addition to high fever and swollen and sore throat, thick sputum has appeared, which is different from that of Beijing. It clogs like strangling one's neck. Quite a few people died suddenly from being suffocated. The tweet also read, "Some government agencies are 99% out of commission. It's basically in a state of anarchy and disorganization, with families fighting and individuals fighting for themselves and not being able to count on anyone else." In addition to China's various cities, large or small, the virus is also hitting rural areas where serious symptoms and death may become more common due to a lack of medical resources and an aging population. Reuters reported that by the end of 2020, rural China had 1.62 healthcare workers per 1,000 people, compared to a national average of 2.9 doctors and 3.3 nurses, showing a huge resource gap in rural China. This village is in Zhejiang province, one of the most affluent rural areas in the country. It seems that the villagers aren't prepared for the outbreak, and many of them think it's a cold.
I'm old, my waist is aching, and my knee is aching. I never catch a cold, and now I'm down with the cold. There are a lot of cases, especially with the elderly. When I come back for a visit, I see many neighbors and relatives who have caught a cold. They all thought it was just a cold, and they felt uncomfortable and without energy. That's about it. Some people don't come out and stay home. Now the atmosphere is still quite good. Everyone knows not to visit others and pay fewer visits to one another.
This is a rural village in southern China that is more impoverished compared to Zhejiang province. The funeral parlor here is full of caskets, and they aren't empty. At such a critical time of mass infection, China's largest transportation season of annual homebound and outbound travel, the Spring Festival transportation, has just begun. The CCP changed the traditional Chinese New Year to Spring Festival. Family reunions are a traditional Chinese custom for the New Year, so a high percentage of people who work or live away from home will be traveling back home to reunite with their parents. On January 6, 2023, the Chinese Information Office held a press conference in which an official from the Ministry of Transportation said that this year's Spring Festival started on January 7th and ended on February 15th, a total of 40 days, with a total passenger flow of nearly 2.1 billion people, an increase of 99.5% over the same period last year. Prior to this, the CCP had already announced that there would be no more nucleic acid tests, temperature readings, or scanning codes for people returning home. In other words, the door to the Spring Festival has been completely opened for 2.1 billion people, which is arguably the largest migration of people on the face of the Earth. Perhaps it can be said that the largest viral migration on the planet has already begun. It's consistent with the CCP's policy of opening the country's doors. In October 2017, the phrase, "building a community with shared future for mankind," was included in the CCP Constitution. In March 2018, it was included in the preamble of the Constitution of the People's Republic of China. Now we will see which people or governments in the world are willing to work with the CCP to build a community of a shared future for humanity. A Thai deputy prime minister and other senior government officials went to the airport to welcome Chinese visitors, and they offered health and epidemic prevention kits and garlands to Chinese tourists. The director of the Thai National Tourism Administration also said to the tourists, "China and Thailand are as close as one family" in Chinese. The Maldives Foreign Ministry issued a statement on its official website and Twitter account that they welcomed the adjustment of China's entry and exit measures and look forward to the early resumption of visits by Chinese tourists. Cambodia's Prime Minister Hun Sen has said he hopes to receive 2 million Chinese tourists this year. Indonesia and other countries have sent Chinese-speaking personnel to greet tourists from China. Chinese restaurants in Bali and other tourist resorts in the country that had been suspended from operation earlier due to the pandemic have resumed business, and local travel agencies have launched Spring Festival-themed travel products.
Before, 90% of our clients, they are it was Chinese, yes. Then we just getting ready and prepare for them to coming back and visit us again. We have 2 shows that's about Chinese song, right? And then we planning to have another interpreter who speak Chinese. This year when China announced like that, it's like Happy New Year for us, to be honest. We will do anything and we're trying to grab hold of this market definitely for sure.